So, and this is another frequently asked question, so why do we use supplements? Why we don't use drugs? Well, the answer is we use both drugs and supplements, but for those patients who can be handled with supplements, that's our preferred way. First of all, most of the supplements have excellent safety profile, and they're kind of natural products that are compatible with your body much, much more than chemicals. Second, in general, we can find that most of the supplements, herbs, vitamins, they have very broad range of efficient concentrations. With the drugs, the therapeutic range or interval much more narrow, and it creates a problem because once you go above that and beyond, you're dealing with toxicity. And finally, there are much more supplements available for various biochemical pathways than the drugs, and in my mind and in mind of my colleagues, it's much, much easier to target specific biochemical pathways with supplements, herbs, minerals, if you know what you're dealing with. So the next slide is talking about necessities. So in general, it's another very popular question. I have gluten intolerance, I have celiac disease. What should I take on a daily basis? And that's how we came up with necessities. So multivitamins and minerals, that's number one on our list. Digestive enzymes, number two. There are different forms of digestive enzymes, as probably most of you know. So there are digestive enzymes of low potency. These are enzymes which come from animal sources like porcine digestive enzymes, also known as pancreatic enzymes. They come from porcine pancreas. They're very similar to human enzymes, but they're very mild in their potency. The second group of enzymes are enzymes which come from plants. And so plant enzymes typically based on enzymes from tropical fruits, mainly papaya and pineapple. These enzymes, they kind of step up compared to porcine enzymes. And finally, there are enzymes which come from mushrooms and fungi. These are enzymes which work at very broad pH ranges, and they have the strongest potency. And depending on your needs, you can choose and pick the brand and the type of enzymes which is the best for you. So probiotics, that's another necessity. As most of you know, there are various brands, various strains, and it's difficult to navigate. In general, for just routine purposes, we recommend multi-strain probiotics containing at least 6 to 8 different strains. And the second very important thing, it's a number of CFUs. So CFU stands for colony forming unit. And on the label of your probiotics, you can find exactly what the numbers are. So for adults, the maintenance number should be around 25 billion CFUs a day. So again, multi-strain probiotics, 25 billion CFUs a day. That's our recommendation. If you're taking antibiotics, if you have some other conditions, the number can go up, in general, up to 100 billion units. In some extreme cases, when we're dealing with colitis, it goes up to 500 billion units. So, but for general purposes, we're talking about 25 billion a day. So prebiotics. Prebiotics are non-digestible carbohydrates or sugars which stimulate production of your own gut microflora. And so there are various prebiotics on the market like FOS, glucomannan, MOS. So our preferred prebiotic, which we're using in our clinic, called MOS, which is mannan oligosaccharide. It comes from the brewer's yeast. And it not only restores your gut microflora, but it also has very strong immune modulating properties. So it normalizes the gut localized immune response, and also there's very unusual property of MOS. It normalizes villi structure of your gut, and those people who have celiac disease, that's the prebiotic of choice. Fish oil or krill oil, so it's another necessity. So it's a source of omega-3 fatty acids, and basically we use it a lot to kind of normalize various inflammatory responses. The maintenance dose or daily dose should be around 2 grams of fish oil a day or 1 gram of krill oil a day. In our practice also we try to combine plant-based oils and animal-based oil, and we typically use combination of fish oil and black currant seed oil. because black currant seed oil is a very valuable source of GLA, and we're using typically around 1 gram of GLA a day. Sodium butyrate, it's a new product which it's in our pipeline. We've been using various brands, and in May we'll have our own kind of patented source of sodium butyrate. So sodium butyrate is a unique product. Number one, it has prebiotic properties, so it stimulates production of normal gut microflora. Number two, this is a drug of choice, or not drug, this is a remedy of choice for patients who have leaky gut syndrome. So sodium butyrate tightens the junction between epithelial cells in your gut, and it stops the leakage. Actually, it can stop the leakage within a couple of weeks. So sodium butyrate in our products will be combined with L-glutamine, which is another valuable amino acid supporting epithelial cells. And again, for those who have gluten intolerance and celiac disease, leaky gut is a big problem, and so we recommend to use sodium butyrate and glutamine on a daily basis. So the dose for sodium butyrate is around 1,500 milligrams a day, and the dose for L-glutamine as a maintenance is around approximately 500 milligrams up to 1,000. One thing to remember that sodium butyrate has very strong anti-yeast properties, and it can be used by itself to treat yeast infections.